Understanding bird flu. A threat to birds and humans. Bird flu, also known as avian influenza, is a highly contagious viral infection that primarily affects birds, especially poultry like chickens and turkeys. Bird flu, or avian influenza, is a virus that primarily affects birds. It can spread through flocks quickly, often leading to high mortality rates. This rapid spread can devastate poultry farms, causing significant economic losses and food supply issues. It can spread through flocks quickly, often leading to high mortality rates. Farmers must take stringent biosecurity measures to prevent outbreaks, including isolating new birds and disinfecting equipment. While less common, bird flu can sometimes jump from birds to humans. This zoonotic transmission can occur through direct contact with infected birds, their droppings, or contaminated surfaces. This can happen through direct contact with infected birds, their droppings, or contaminated surfaces. People working in close proximity to birds, such as farmers and poultry workers, are at higher risk. Humans can contract various strains of bird flu, but some are more dangerous than others. The symptoms in humans can range from mild respiratory issues to severe, life-threatening conditions. The H5N1 strain, in particular, is known for its severity in humans. It has a high mortality rate and can cause severe respiratory illness, making it a significant public health concern. Symptoms of bird flu in humans can range from mild, like a common cold, to severe respiratory illness. These symptoms can escalate quickly, requiring immediate medical attention. The possibility of bird flu spreading among humans is a serious concern for global health. It underscores the need for vigilant monitoring and rapid response to potential outbreaks to prevent a pandemic. It highlights the interconnectedness of animal and human health, and the importance of monitoring and controlling diseases in both populations. Collaborative efforts between veterinarians, healthcare professionals, and researchers are crucial in managing and mitigating the risks associated with bird flu. The first alarm bell. A severe case in Louisiana. The seriousness of the current bird flu situation came to light with the first severe human case in the United States. This alarming development has raised concerns among health officials and the general public alike. A 65-year-old individual from Louisiana fell critically ill, experiencing serious respiratory problems. The patient was quickly hospitalized and placed under intensive care, highlighting the severity of the infection. This case marked a turning point as previous human cases in the U.S. had been mild. The sudden escalation in the severity of symptoms has prompted a re-evaluation of the risks associated with the bird flu virus. The Louisiana patient's exposure to bird flu was traced back to backyard flocks. This discovery has led to increased scrutiny of small-scale poultry farming practices and their role in the spread of the virus. This finding emphasizes the importance of vigilance, even in seemingly low-risk settings. It serves as a stark reminder that the virus can spread in unexpected ways, affecting those who may not consider themselves at high risk. It underscores the need for biosecurity measures, even for those keeping small flocks of birds at home. Implementing proper safety protocols can significantly reduce the risk of transmission and protect both humans and animals. The CDC confirmed that the Louisiana case involved the H5N1 strain, the same one circulating among wild birds and poultry in the US and Canada. This strain has been closely monitored due to its potential to cause severe outbreaks. This strain is known for its potential to cause severe illness in humans, making the situation particularly worrying. The case in Louisiana serves as a critical reminder of the ongoing threat posed by bird flu and the need for continued vigilance and preparedness. Unraveling the culprit, the H5N1 virus strain. The H5N1 virus strain is a highly pathogenic avian influenza virus, meaning it can cause severe illness and death in birds. This strain has been circulating globally for over 2 decades and has been responsible for outbreaks in poultry and wild bird populations. The H5N1 virus can mutate, making it difficult to control. These mutations can make the virus more transmissible among birds and increase its ability to jump to other species, including humans. The current outbreak involves a specific genetic variant of the H5N1 virus that appears to be particularly well adapted to spread among wild birds. This poses a significant challenge for containment efforts, as migratory birds can carry the virus over long distances. Section 4 California on high alert. A state of emergency declared. California, a state with a significant agricultural industry, has been hit particularly hard by the current bird flu outbreak. The virus has been detected in wild birds and poultry flocks, and alarmingly, it has also been found in dairy cows in the state. In response to the growing threat, Governor Gavin Newsom declared a state of emergency in California on December 18, 2024. This declaration allows the state to allocate resources more effectively and implement emergency measures to control the outbreak. California has been proactive in its response, establishing the nation's most extensive bird flu testing and monitoring system. The state has also focused on providing resources and information to workers in the poultry and dairy industries, including personal protective equipment and multilingual outreach programs. Section 5. Bird flu, by the numbers, a national perspective. The bird flu situation is not limited to California. As of December 18, 2024, there have been 61 confirmed human bird flu cases across 7 U.S. states, with California accounting for 34 of them. The majority of human cases in the U.S. have been linked to direct contact with infected birds, particularly in poultry farms. This highlights the importance of biosecurity measures in these settings to prevent the virus from spreading from birds to humans. The CDC is actively monitoring the situation, using its extensive flu surveillance systems to track the spread of the H5N1 virus. They are working closely with state and local health departments to investigate cases, track outbreaks, and implement control measures. Section 6. Recognizing the signs, symptoms and prevention of bird flu. Bird flu in humans can manifest in various ways, with symptoms ranging from mild to severe. It is important to be aware of these symptoms to seek timely medical attention. Common symptoms include sore throat, which can be quite painful and persistent, cough, which may be dry or productive, fever, which can be high and accompanied by chills, and runny nose, which can cause discomfort. Other symptoms include headache, which can be severe, body aches, fatigue, and shortness of breath, making it difficult to perform daily activities. In more serious cases, individuals may experience nausea, vomiting, diarrhea, and even seizures, which require immediate medical attention. Preventing the spread of bird flu requires a multi-pronged approach. It is essential to follow several preventive measures to protect oneself and others. Avoiding contact with infected birds is crucial, especially for those working in the poultry or dairy industries. This includes not touching birds that appear sick or dead. Wearing appropriate personal protective equipment, such as gloves, masks, and protective clothing, is essential when handling birds or working in areas where they are present. This helps to minimize the risk of transmission. Ensuring that protective gear is worn correctly and consistently can make a significant difference in preventing the spread of the virus. Frequent hand washing with soap and water is another critical preventive measure. It is important to wash hands thoroughly for at least 20 seconds. If soap and water are unavailable, using an alcohol-based hand sanitizer is a suitable alternative. Make sure the sanitizer contains at least 60% alcohol. Getting the seasonal flu shot can also help reduce the risk of contracting and spreading bird flu. Vaccination is a key component in maintaining public health. Section 7. The looming threat. Could this be the next pandemic? While the current public health risk from bird flu remains low, the recent developments have raised concerns about a potential pandemic. The H5N1 virus's ability to mutate and spread among different species, including humans, makes it a serious threat. The possibility of human-to-human transmission of bird flu is particularly worrying. While there have been no confirmed cases of this type of transmission so far, the virus's unpredictable nature means this remains a possibility. The current situation underscores the importance of public health vigilance and preparedness. Ongoing monitoring of bird populations, early detection of outbreaks, and rapid response efforts are crucial to containing the spread of the virus. International collaboration is also essential to share information, coordinate surveillance efforts, and develop effective vaccines and treatments. Please like and subscribe for continuous info and updates. Stay safe out there.